Did you know that cardiovascular disease is the leading cause of death for both men and women in the whole world? And that there are many subtle signs that can be easily missed? I'll tell you exactly what to look for. First, we'll dive into the 7 signs that are less obvious. Then we'll move on to the 7 classic symptoms. Now let's get into it. Earlobe creases, Frank's sign. Have you ever noticed a little diagonal line in your earlobe? It might seem like a small thing, but it could actually be a clue about your heart health. This line is called Frank's sign, named after Dr. Sanders Frank, who first spotted its connection to heart issues. Hair loss on legs. You might not think much about it, but it could actually be a sign of something going on with your circulation. When you start noticing hair disappearing, especially on your lower legs, it might be a clue about a condition called peripheral arterial disease. This happens when the arteries in your legs get narrow because of plaque buildup, making it harder for blood to flow properly. So, if you're seeing less hair down there, it might be worth mentioning to your doctor just to be on the safe side. Xanthelasma. Let's shine a light on something you might not expect. Yellowish plaques on your eyelids. These little patches, often hanging out near the inner corners of your eyes, are called xanthelasma. Now, they might not seem like a big deal, but they could be giving you a heads up about your cholesterol levels and even your heart health. See, having these yellowish bits can sometimes mean your cholesterol is on the higher side, which in turn can up your risk of heart disease. If you spot these little patches, it might be worth chatting with your doc about your cholesterol just to stay in the know. Arcus Senilis. This one might catch your eye literally. Ever notice a grayish-white ring around your cornea? That's what we call Arcus Senilis. This little ring is kind of like a halo around our cornea. But here's the thing. If you're on the younger side and you notice this ring, it might be worth taking note. It could be a subtle sign that your cholesterol levels are too high, and that could correlate to a higher risk of heart issues down the road. Let's talk about a color that your skin might turn if something's not quite right. Cyanosis. It's that bluish or purple hue that you might notice especially in your hands or feet. Sometimes this change in color could be a sign that your blood isn't circulating or getting enough oxygen, and that could point to issues with your heart or lungs. It's definitely something worth mentioning to your doctor if you notice your skin taking on an unusual shade. The next of our unusual signs is indicated on the legs or feet. Leg ulcers. These stubborn sores that just won't seem to heal hang around on the outside of your leg or near your ankles. They can be a signal that something's not quite right with your circulation, which might be linked to issues with your arteries. Jaw pain. Jaw pain is something you might not normally associate with your heart, but it's worth paying attention to. During a heart attack, jaw pain can feel like a dull ache or pressure around your jaw, neck, or throat. It might even spread from your chest. Now, this isn't your usual toothache or jaw joint pain, as it's often joined by some of the other signs in this video. Now listen up. A 2012 study published in the American Journal of Emergency Medicine found that among patients presenting to the emergency department, With acute coronary syndrome, ACS, a significant proportion reported experiencing jaw pain as a symptom. And a 2009 study published in the Journal of American Dental Association highlighted the importance of dental professionals being aware of potential cardiac origins of jaw pain, particularly in patients with risk factors for heart disease. This research underscores the importance of recognizing jaw pain as a potential symptom of a heart-related issue. So, if that jaw pain suddenly hits alongside any of the other symptoms, or if you have a history of heart issues or any of those typical risk factors like high blood pressure, cholesterol, diabetes, or smoking, and you're feeling that jaw pain, don't hesitate to get it checked out pronto. Now on to our classic symptoms. Nausea. During a heart attack, nausea may be caused by the stress and pain affecting the autonomic nervous system, leading to gastrointestinal distress. However, nausea can have various causes, so experiencing it alone doesn't necessarily mean you're having a heart attack. Shortness of breath. Feeling short of breath or getting winded too easily, especially with minimal exertion, is something to take seriously. In fact, according to recent studies, around 1 in 3 people with long COVID experience persistent shortness of breath, even after recovering from the initial infection. While the direct link between long COVID and heart attacks is still being studied, emerging evidence suggests that individuals with long COVID may be at an increased risk of cardiovascular problems, including myocarditis, arrhythmias, and even heart attacks. If you're finding it hard to catch your breath during everyday activities, it could be a sign of something more than just being out of shape. Cough with white or pink phlegm. Experiencing a lingering cough accompanied by white or pinkish phlegm could signal fluid accumulation in your lungs. This symptom isn't something to brush off, as it could be a red flag for underlying heart problems. And here's an eye-opener. Research suggests that individuals with heart failure often experience this type of cough, indicating fluid buildup in the lungs, even after the acute phase of their condition has passed. Phlegm with pinkish color usually indicates blood due to a damaged or inflamed respiratory tract. If you're experiencing this, it's wise to seek medical advice to rule out any heart-related issues. Difficulty lying flat. If you know anyone who struggles with laying flat and feeling breathless when laying down, it could indicate a condition called orthopnea. What's happening here is that fluid accumulates in the lungs, making it harder to breathe when in a supine position. This sensation prompts individuals to prop themselves up with pillows or sleep in a more upright position to ease their breathing. It's important to address this symptom promptly, as it may signify worsening heart function or underlying health issues. Chronic fatigue. Feeling excessively tired or weak and struggling with daily tasks could signal a variety of underlying health issues, including heart problems. While this symptom could be caused by a number of factors, including hormonal changes or poor nutritional intake, it's important to take it seriously. This fatigue is often disproportionate to the level of activity or exertion. A 2015 study published in the National Academy of Medicine revealed that chronic fatigue syndrome, affects somewhere between 836,000 to 2.5 million Americans, with an estimated 84 to 91% of cases undiagnosed. This study sheds light on the significant impact of chronic fatigue on public health and underscores the need for more research and awareness in this area. It's important not to ignore persistent fatigue, as it could indicate an underlying heart condition or other medical concerns that require prompt attention. Frequent nighttime bathroom trips. This one is sure to surprise you. Frequent nighttime bathroom trips, known as Nocturia, are often attributed to excess fluid buildup and can be indicative of various health conditions, including heart issues. This symptom involves waking up multiple times during the night to urinate, disrupting sleep patterns, and causing discomfort. It's essential to monitor nocturia frequency and discuss it with a healthcare provider to determine its underlying cause and appropriate management. But don't worry too much, folks. It can also just mean you're drinking a healthy amount of fluids, and your body is just doing what it's supposed to do. You should only worry if it's accompanied by other symptoms on our list. Intermittent claudication. When your legs ache or cramp up while walking, especially during your daily strolls, that's what we call intermittent claudication. It's like your body is signaling a traffic jam in your arteries, making it tough for enough oxygen to reach your leg muscles when you're on the move. The good news is, usually, taking a break can ease the discomfort, but if it keeps happening, it's essential to chat with your doc. They can help figure out what's causing it and suggest ways to manage it, so you can keep striding without the ache. Chest discomfort. Ever felt a bit of pressure or tightness in your chest? Maybe even a burning sensation? Sometimes that discomfort doesn't just stay put. It can spread to your arms, neck, or even your jaw. It's your body's way of raising the alarm, saying, "Hey, something's up." Don't brush it off. Listen to what your heart's saying and give your doctor a visit. Now, how can you keep your heart in tip-top shape and prevent heart disease? Well, there's a lot to go over, so I'll meet you in our next video, linked right here. What did you learn in this video? Did we miss anything? Let us know in the comments below. By liking and sharing, YouTube will help spread the word to folks who might not have easy access to doctors or hospitals. You can make a real difference to your friends and family and even save lives. Let's take care of each other and spread the word about heart health and disease prevention. Thanks for watching. Until next time, stay well, my friends.